Good afternoon, and welcome to the Foundation Fighting Blindness Insights Forum call. I'm Chris Adams, the Vice President of Marketing and Communications at the Foundation. We appreciate everyone joining us for today's forum. I would like to briefly review some logistical details for the call. Currently, all participant lines are in listen-only mode with no video. Today's conference is being recorded and is also a closed caption. To activate the closed captioning, please select the closed captioning option located at the bottom of the Zoom interface. Please note that today's event does not have any slides. Our speakers do have their videos live, however, all their comments will be purely in audio format. If you are using a screen reader, please be aware that the controls are at the bottom of the Zoom interface. This control bar may collapse when it's not in use. If you prefer to prevent the controls from auto-hiding, go to the settings within the Zoom platform, select accessibility, and then select always show meeting controls. It might be helpful to maximize your window and navigate by using the tab key. Additional buttons and settings are also available by pressing the alt key. During the call, you may ask questions through the Q&A and chat features, or by sending an email to info@fightingblindness.org. We will address all questions toward the end of the call during the Q&A session, at which time additional instructions for asking questions will be provided. At this time, I'd like to turn the call over to Jason Menzo.
Very good. Thank you, Chris, and thank you everyone for joining us today. We've got a very exciting call planned. My name is Jason Menzo, and I am the Chief Operating Officer here at the Foundation Fighting Blindness. I'd like to welcome you all to our quarterly Insights Forum call, which is focused on highlighting the latest developments here at the Foundation Fighting Blindness and the broader inherited retinal disease community.
First, I'm going to highlight some of our activities and events focused on increasing community engagement, fundraising, and public awareness for our mission. I will also be providing a summary of our audited fiscal year 2020 financial results and our performance update for the first quarter of fiscal year 2021. Then our CEO, Dr. Ben Yerxa, will share some recent progress and exciting developments related to our research funding. And then we will be joined by our featured guest speaker, Mr. Halden Connor, who's the chairman and CEO and co-founder of Nacuity Pharmaceuticals, which is a clinical stage pharmaceutical company developing a breakthrough treatment for the treatment of retinitis pigmentosa and potentially other ophthalmic conditions. Following our formal remarks, we will have a question and answer period. And at that time, Chris will repeat the instructions on how to ask your questions. And as Chris mentioned, this call is being closed captioned, and a replay and fully accessible transcript of this call will be available on our website in the weeks ahead. If you have any feedback related to accessibility or really related to the foundation in general, please reach out to us at the email address info@fightingblindness.org. All right, let's get started. I wanted to start today's call by sharing some very exciting news. As you may know, the foundation was founded in September of 1971, and in the 49 years that have followed, many of the critical advancements that have happened in our field are directly as a result of our work at the foundation, including the first ever gene therapy approved to treat certain blinding conditions and the more than 40 clinical trials that are underway all across the globe today. There's meaningful progress happening all over the place, and as we prepare to celebrate 50 years of impact, we are launching a new theme for the Foundation Fighting Blindness called Together We're Winning. This new campaign emphasizes all the many constituents included in our national organization, of course, the scientific community, our chapters, our volunteers, and our donors all coming together to fight the diseases that cause blindness. And that said, it's not just about fighting the diseases. It's about finding ways to celebrate all the many wins and the small victories that are happening along the way. This new Together We're Winning campaign was launched at the beginning of October to coincide with Blindness Awareness Month. And as we're preparing for our 50th anniversary year coming up in just a few months, as we kick off 2021, expect to see a lot more emphasis on the many ways that we are winning together as a community. And building off of this campaign, one of our key initiatives in this coming year is to connect more deeply within the communities across the country through our national chapter network. We thoroughly believe that a high-performing and well-structured community-based grassroots organization will provide an immense amount of energy and support for our organization and mission. Our vision is to develop an even stronger national chapter network, building on the success of our current footprint, which is about 40 markets strong, and growing it, both in terms of the number of active chapters, as well as the number of engaged members participating in each of our chapters. We have begun this process and executing our plans with the hiring of a really key individual who's going to be joining our team. Actually, she joined our team earlier this week as our National Director of Chapter Engagement. Her name is Ms. Renee Paulsell, and she joined our team just on Monday. We're super excited to be reinvesting and reinvigorating our national chapter network, and there's a whole lot more news to come on that front in the weeks and months ahead. Shifting gears, as we continue to navigate the challenging environment caused by the global pandemic, we've been working not just to navigate, but actually to thrive in this new environment. And one of our latest initiatives along those lines is a series that we launched over the summer called Music to Our Eyes. I'm sure many of you on the call here today participated in this first event. It was a live stream music series which featured a concert and conversation with a special guest that has a connection to our mission. The purpose of the series is to raise awareness and funds, especially among new audiences who may not be familiar with the foundation. Our first event was back in August with the acclaimed rock band X Ambassadors. The band shared personal stories of their connection to our mission and played a few of their top hits, including the songs Renegades and Unsteady. And that initial kickoff of the series had more than 40,000 views on Facebook. And a replay of the event can be found on our YouTube and Facebook pages. I want to take a moment and thank our critical partners on this event, the two Blind brothers, who, as you probably know, were founded by Bradford and Brian Manning. They formed this apparel company to create ultra soft clothing, build community, and donate 100% of the profits towards research to find cures for blinding conditions. We're so grateful for their support and for all the participants who participated and donated to the program. The good news is, as I mentioned a few minutes ago, it is a series. And this is an event that we plan on repeating every quarter with a different act. And we're very excited to be announcing the next act in the series in the next couple weeks. So stay tuned. Another special day for the foundation was our fall National Virtual Vision Walk that was held this past Saturday, October 24th. This was a one-day event and was a great opportunity for the Vision Walk supporters from across the country to come together virtually to raise awareness and funds for our mission. This year, Vision Walkers were encouraged to be creative in how they participated, with some of them walking on treadmills, others walking on socially distanced walks at their local park or in their neighborhood, and many hosted virtual meetings with their team. The program featured some of the teams from across the country and sharing their experiences and their stories online. It was a terrific success. It was a great day for our community. And I'm proud to announce that the event exceeded $1 million raised, and it adds to the great success of the Vision Walk series over time. It's been 15 years since we launched Vision Walk, and through the generosity of more than 200,000 walkers, donors, corporate sponsors, the Vision Walk has raised more than $55 million to fund research, which is awesome. So thank you to all who participated, and I wanted to share that great news with everyone here today. In addition to the key fundraisers such as Vision Walk, we also wanted to share some news about how we're partnering with the corporate world and industry to provide financial support for some of our initiatives. I'm pleased to announce that we have 2 new corporate sponsors of our My Retina Tracker program, which offers open access, no-cost genetic test and genetic counseling for individuals living in the United States with a clinical diagnosis of inherited retinal disease. These corporate partners are so critical to our success, and we look to add more as the weeks and months ahead. In this current world of virtual events, we continue to search for innovative opportunities for our community to connect. And a couple of these opportunities coming up include our national chapter webinar, which will be held on Saturday, November 21st, 2020, from 12 to 1:30 p.m. Eastern Time. This event is presented by the Foundation Fighting Blindness Arizona and Cincinnati Northern Kentucky chapters, and will feature two speakers, Ben Shaverman, who is the Foundation's Senior Director of Scientific Outreach, and he will provide an update on the latest in research and Foundation news. And then Dr. Paul Bernstein, who is a well-recognized expert in nutrition for retinal health and is with the Moran Eye Center at the University of Utah. And he will present perspectives and nutritional habits and therapies for people with inherited retinal diseases and age-related macular degeneration. Another exciting event that we've got planned coming up in the new year is on Sunday, February 28th, 2021, and we're calling this Hope from Home, a United Night to Save Sight. This event will celebrate Rare Disease Day and help kick off the Foundation's 50th anniversary year. It'll be an interactive virtual experience and will feature incredible entertainment and provide an opportunity to connect with others from the comfort of your own home, all while raising critical funds, again, to further our mission. So I know that there was a lot of information I just shared in dates and times, and the good news is that all of this can be found on our website at www.fightingblindness.org. And to that end, I wanted to highlight one other important resource that we have on our website, and it's called the Clinical Trial Pipeline. On the screen right now, I'm showing this resource, and it can be found by going to fightingblindness.org and then clicking on the Research tab, and then the section called Clinical Trial Pipeline. There you'll find a list of all the known clinical trials being conducted in the inherited retinal disease space all across the globe, along with their disease focus, phase of progress in clinical development, and the sponsoring organization. It's a really important resource, and I wanted to make sure that everyone knew that it existed and where to find it. And then while on our website, in the next few days, you'll actually see something really exciting and new that we're going to be launching. It is the official launch of the Foundation Fighting Blindness merchandise store. And we're excited to be launching this just in time for the holidays. So you can show off your support for the foundation with a variety of t-shirts, hats, coffee mugs, and even a few items for your furry friends. And these products are a really easy way to help increase awareness for the foundation and support our mission. And we're excited to be launching it in the coming days. I'd like to wrap up my section of today's forum by providing a brief summary of our financial position. As a reminder, the foundation operates on a fiscal year that goes from July to June. So our 2020 fiscal year just ended on June 30th. First, our final audited financial results for fiscal 2020. Our total revenue for fiscal 2020 was $34.7 million and included $3.1 million of investment income and a new $15 million commitment for the RD fund. This was against operating expenses of $14 million. The net result was an organizational surplus of about $6 million, which will support new clinical and preclinical research to add to our previous commitments in the area of science and research. The audited financial statements will be available later this fall on our website in the About Us section under financial reporting. And then for fiscal year 2021, our budget includes targeted revenues of $21.2 million against operating expenses of $14.5 million, with funds to support new research of approximately $6.7 million. Through the first quarter of the year, we've generated revenue of $2 million against expenses of $3 million, which is roughly in line with our expectations and our budget. It's important to note that the first quarter of every fiscal year is typically our lowest in terms of revenue. And that changes as fundraising activities gear up as we get later into the fall and into the winter and towards the end of the calendar year. That said, we are experiencing declines in revenue due to COVID-19, and we're working very hard to address those through the many creative activities and events that I just outlined earlier in the call today. We are so humbled and grateful by all the support and funding and volunteering and everything that everyone in our community does to enable us to fund critical research during these challenging times. And while we can't predict the short or long-term consequences of the pandemic, we know we can count on the strong support of our community, and we can't thank you enough for your continued generosity and support. I'm now very pleased to turn the call over to our CEO, Dr. Ben Yerxa.
Thank you, Jason, and good afternoon. Thank you for joining us on our quarterly update call. This afternoon, I'd like to provide updates in several areas, including our ongoing core research awards, recent scientific events, and the RD Fund. Then I'll introduce our featured guest speaker, Nacuity CEO, Alden Connor. So let's start with our core research awards. We continue to make excellent progress in implementing our 5-year strategic plan initiatives. In August of this year, we announced and designated $6.5 million in funding for 15 new grants, bringing our current research portfolio to a total of 84 grants. The projects were selected from 134 proposal submissions that were rigorously evaluated and scored by the Foundation's Scientific Advisory Board, which is comprised of the world's top retinal disease experts. We just hosted our annual advisory board meeting virtually, and it's always inspiring to interact with these physicians and researchers who are leading the efforts to increase our understanding of inherited retinal diseases. We are committed to projects that will lead to vision-saving treatments and cures. Our funding strategy also focuses on critical research gaps that, when addressed, will move the whole field forward in a significant way. One key focus over the next few months is our annual call for applications for research project funding. We are currently accepting applications for our new Translational Research Acceleration Awards. We call these our TRAP Awards, which have an important focus on research with particular promise that we would like to accelerate towards clinical trials. The TRAP funding provides a really important bridge between traditional early academic research and later stage clinical development funded through the RD Fund. These awards are expected to be made by the end of calendar year 2020. We are currently accepting applications for the Free Family AMD program, which supports research into age-related macular degeneration. These awards are expected to be made by the end of calendar year 2020 also. For other broad-ranging research, we are currently accepting applications for individual investigator, clinical innovation, career development, and program project awards, with Scientific Advisory Board recommendations expected by late spring 2021. So moving on, I'd like to highlight 2 recent events held in conjunction with the IRD scientific and medical community. In mid-October, we hosted our second online continuing medical education course, which was led by Dr. Rachel Huckfeld, Associate Surgeon and Director of IRD Fellowships at Mass Eye and Ear, and Assistant Professor of Ophthalmology at Harvard Medical School. The course covered topics related to care and management of patients with IRDs. In mid-September, we also hosted a virtual scientific workshop on the topic of inflammation and viral gene therapy of the retina. The purpose of this event was to bring academia and industry together to present their preclinical and clinical data and openly discuss the observations, challenges, and implications of inflammation in retinal gene therapy. The goal was to identify critical knowledge gaps the Foundation may be able to direct research funding towards in the future. As a way of background, we generally know that injecting a gene therapy into the eye leads to inflammation in most instances. The amount of inflammation is variable and depends on the specific characteristics of each given gene therapy. And just to be clear, this inflammation can be controlled clinically, but if we understand the cause of the inflammation, we may be able to help clinicians and researchers improve these therapies even more. We had 25 participants from 5 countries who participated in the workshop, and our team is now preparing a summary publication to share the findings publicly. So I'd like to wrap up my remarks today by highlighting some exciting developments related to the RD Fund and our portfolio companies. The RD Fund is part of our long-term strategy for adapting to a rapidly changing environment where many more projects are ready for translation into human trials, while simultaneously the cost of clinical research is increasing. The RD Fund currently has more than $70 million in funding for companies with projects that can be in clinical testing in 18 to 24 months. To date, the RD Fund has committed funding to 10 companies, including disclosed investments in Atsina, Checked Up, Nacuity, Nion, Procure, Sparing Vision, Stargazer, and Videre Bio. There have been several exciting recent developments I'd like to summarize, and you may have seen the news. First is Sparing Vision, which is a French biotechnology company developing a gene-independent treatment for retinitis pigmentosa, the most common inherited retinal degeneration. There's currently no treatment to treat all genetic forms of this rare retinal disease that leads to blindness and affects nearly 2 million people worldwide. Last week, Sparing Vision made several important strategic announcements. It was announced that the company's chairman of the board, Stéphane Boissel, has been appointed Chief Executive Officer of Sparing Vision. And the company announced it has raised new funding through a 44.5 million euro financing round, which translates roughly to 53 million US dollars. Several new leading global investors participated in the financing, including 4Bio Capital, UPMC Enterprises, JTO Capital, and Isios Capital. In addition, current investors, the RD Fund and BPI France, participated in the financing. The RD Fund invested an additional $6 million in this round, which builds on the fund's original $8 million investment in 2016. The proceeds from the financing will be primarily used to advance the development of Sparing Vision's breakthrough treatment, SPVN-06 for RP. The company is preparing to conduct an initial clinical safety study scheduled to start in 2021. And just keep in mind, the clinical trials and endpoint for RP may take 1 to 2 years to follow up. So the good news is the company has plenty of money to complete phase 1 and phase 2 testing to get a real readout on the possible efficacy of this drug in a phase 2 trial. The other exciting recent development from the RD Fund relates to Videre Bio, a biotech company that is focused on next-generation optogenetic gene therapy as an approach to restore vision in eyes that have lost most vision due to degeneration of photoreceptors. This is a technology that has the potential to work regardless of the genetic cause of the disease, and it works by introducing a light-responsive gene into cells that do not normally respond to light, making them light-sensitive. The company's technology is based on work primarily from the labs of Dr. Udi Isikoff and John Flannery of UC Berkeley and technology from the University of Pennsylvania. Videre Bio was launched in June 2019 with a $21 million financing led by Atlas Venture, of which the RD Fund contributed $3 million, effectively leveraging its capital sevenfold. Because of the competitive nature of this field, the company remained in, quote, stealth mode until this time. With $21 million of fresh capital, the new team was able to make amazing progress in just 14 months to generate a viable clinical candidate for optogenetic gene therapy. This fast-moving advanced technology, no surprise, caught the attention of industry leaders, and now we are pleased to announce that Videre Bio has been acquired by Novartis for $150 million in upfront payments, and with milestones, the total economics are approximately $280 million. This represents the first exit for the RD Fund and essentially validates the power of the venture philanthropy model for accelerating our mission while providing for meaningful returns to support the Foundation's mission in the future. Importantly, this new technology is now in the hands of skilled developers who plan to invest significant resources to bring this technology into the clinic and, if successful, ultimately to patients in need. One additional benefit of this transaction is that the RD Fund is also invested in the same team who formed Videre Bio 2, the spin-out of Videre Bio 1, which is working on next-generation gene therapies for retinal degenerative diseases. So these recent announcements from Sparing Vision and Videre Bio are essentially strong proof points of the impact of venture philanthropy in achieving real and accelerated progress in the development of new therapies for patients with vision loss. For the millions of people globally living with inherited retinal degenerations, the advancement of novel therapies provides hope for the future. Another important company that is developing promising therapies targeted towards a broad range of IRD disease is Nacuity. The company is working on a breakthrough treatment for retinitis pigmentosa and Usher syndrome, addressing oxidative stress in the retina, which causes cell degeneration and vision loss in virtually all forms of RP. We're hopeful that Nacuity's approach using N-acetyl-cysteine amide, or NACA, with its antioxidative properties can benefit most people with RP, regardless of the gene mutation causing their disease. We are excited the NACA drug has completed phase 1 clinical trials and is proceeding to phase 2. The foundation, through our RD fund, has committed to providing initial milestone-based and equity funding of $7.5 million to advance the potential therapy into and through a phase 2 clinical trial. We are pleased to have on the call with us today Halden Connor, Nacuity's chairman, CEO, and co-founder, to share an update on their programs and clinical progress. Halden helped co-found Nacuity in 2016. During his extensive career in the ophthalmology field, he has served as a board director for Alcon Laboratories and as an advisory council member for Wilmer Eye Institute. He was also the co-founder of Proton International, a leading device manufacturer of proton therapy technology. So without further ado, I'd like to welcome Halden and turn the call over to him. Halden, please go ahead.
Thank you for the introduction, Ben, and good afternoon or morning, everyone, as the case may be where you are. It's a great pleasure to take part in this October edition of the Foundation Fighting Blindness Insights Forum. I want to thank Ben, Jason, Chris, and the rest of the Foundation team for this invitation to speak to you today. It's always a pleasure to speak to this community about our work, particularly given how important the Foundation has been to our progress, both financially and through their scientific support. As Ben said, my name is Halden Connor, and I am CEO and co-founder of Nacuity Pharmaceuticals. Nacuity is a clinical stage pharmaceutical company based in Fort Worth, Texas, with a mission to advance a promising therapy to slow or stop the progression of the blinding effects of retinitis pigmentosa. We follow and build on the research findings that originated in the lab of Dr. Peter Campachero at the Wilmer Institute at Johns Hopkins University, which also benefited through the funding from the foundation. Through his research and clinical observations, Dr. Campachero concluded that in patients with RP, photoreceptors, the rods and cones, were differently affected by the multitude of genetic mutations that cause RP. He believed the genetic mutations mostly damaged only the rods, that the subsequent death of the rods created significant oxygen overload or oxidative stress in the retina, and that oxidative stress in turn compromised the cones, which led to the loss of central vision. About that time, I was involved with a group exploring neurological and other uses of the small molecule N-acetylcysteine amide, or NACA. And that group believed it could be useful in ophthalmology. Accordingly, I reached out to Dr. Campachero, learned of his work exploring antioxidants for RP, and asked if he would be interested in evaluating NACA, which of course he was. Once we provided him NACA, he studied the effects of orally administered NACA in a mouse model of RP, his RD10 mice strain, with very favorable results. Those results, along with confirming belief from other members of the ophthalmological drug development community, inspired us to found Nacuity to advance this promising therapy for RP. Fortunately, we are based in Fort Worth, Texas, the home of Alcon Laboratories, one of the leading ophthalmological pharmaceutical companies in the world. As I have a long-standing relationship with Alcon and many of its key leaders and scientists, I was able to attract some top talent with years of productive experience at Alcon to join Nacuity, which has proven to be an invaluable asset as we have proceeded forward. Our team has been successful in producing a good manufacturing practices grade of NACA we designated NPI-001, putting it in tablet form for easy administration, completing the required preclinical toxicology programs, successfully filing an IND with the FDA, completing a phase 1 clinical trial in healthy volunteers in Australia, and gaining ethics committee approval for and beginning a phase 1/2 trial also in Australia, focused on the treatment of RP in patients with Usher syndrome. We are very excited that our RP trial for Usher has thus far enrolled 4 patients who have been on drug now for 30 days. And after a planned safety assessment in November, the study will open for full enrollment. We expect to have our first round of safety data from this trial by the 4th quarter of next year, and findings of efficacy by mid to late 2022. As Usher syndrome is an ultra-orphan disease, and if our findings of safety and efficacy warranted such action, we would approach the Therapeutic Drugs Administration in Australia, which is the equivalent of our US FDA, seeking expanded use for NPI-001, thus providing the earliest possible access to the drug for Usher and RP patients. Assuming our safety data is positive in late 2021 next year, we plan to amend our US IND with the FDA in preparation for a pivotal phase 2 trial in the US for patients with RP. As we have sought other opportunities for ophthalmic use of our expanding library of small antioxidant molecules, the Foundation suggested we explore the use of our antioxidants for cataract prevention, since they were aware RP patients develop cataracts to a greater extent than the general population, likely due to the elevated oxidative stress in the eye due to the death of the rods. Therefore, we began exploring use of our compounds for slowing the progression of cataracts by delivering our antioxidants via a biodegradable intravitreal implant. We have demonstrated that our drug elutes favorably from the implant after insertion into the vitreous humor, and we are presently conducting a non-clinical safety study of our antioxidant-infused implant. We have been extremely fortunate to have an outstanding scientific advisory board guiding us over the past several years. And for the purpose of our anti-cataract product development, we were most pleased to have recently added to our SAB, at the suggestion of Ben Yerxa, Dr. Nancy Holkamp, Professor of Clinical Ophthalmology and Visual Sciences at the Washington University School of Medicine in St. Louis, Missouri. In addition to being a retinal specialist and surgeon, Dr. Holkamp is a pioneering researcher and leading authority on the role of oxidative stress in the formation of cataracts, and is enthusiastically advising us about this program. Assuming our toxicology studies results are favorable, we plan to initiate a proof of concept clinical study early next year and expect to have preliminary results by the end of 2020. The ability of our compounds to attenuate the effects of oxidative stress has the Nacuity team looking at the effects of our compounds in other ophthalmological conditions. Thus, we continue to actively synthesize and screen our compounds for efficacy in these other ophthalmic diseases involving oxidative stress. Our entire team is very excited to lead the way in exploring treatments for ophthalmological diseases involving oxidative stress, and we are very pleased to be in the clinic to demonstrate the value of NPI-001 for the treatment of RP. Your participation in this Insights Forum is appreciated, as is the opportunity to update you on Nacuity's progress. I want to reiterate our thanks to the Foundation Fighting Blindness for their continued support of our work, without which our hope of delivering meaningful assistance to the IRD community would be sorely compromised. Thank you.
Very good. Well, thank you so much, Halden. That was a terrific update. And on behalf of everyone at the foundation, and of course the IRD Fund, and on behalf of the whole community, we're really excited to consider a broad potential treatment that could address the needs of nearly 2 million people who are affected worldwide with RP. And we're all watching and anxious to hear more progress in the months ahead. So much success to you and the team at Acuity. We're now going to open up the call and take your questions and comments. And I'm going to ask Chris to reiterate the instructions for asking questions.
Thanks, Jason. As a reminder, there are several methods for asking questions. First, you may access the Q&A and chat features located at the bottom of the Zoom control bar and type in your questions. Second, you may ask questions verbally. To do so, please select the hand-raising function on the menu bar at the bottom of the Zoom interface, and we will provide you with instructions to unmute yourself. And third, if you joined by phone for today's call, you can press *9 to raise your hand. Pressing *6 will mute and unmute your line. You may also submit your questions via email to info@fightingblindness.org. Again, that is info@fightingblindness.org. Please note that if there are questions that we aren't able to answer on today's call due to time constraints, we will follow up with you directly via email over the next week or two. Thank you.
Awesome. Thank you so much, Chris. And while we're compiling our questions, I do want to take a moment and just remind everyone, as Chris had mentioned earlier, that there will be a transcript and an audio recording of today's call. It'll be on our website within the next week. And if there's any information or any other questions or comments that you have, you can always send us an email at info@fightingblindness.org. We're also streaming right now live on Facebook. And so hi to everyone on Facebook. Those who are chatting on Facebook, our team is monitoring the questions that come up there as well, and we'll bring them into the discussion here as appropriate. So the first question, which I think is probably on a lot of folks' mind, is about the pandemic and whether or not, or I guess not whether or not, but how the pandemic is impacting retinal research in terms of federal funding, timelines, and really just the general state of affairs in the clinical world as it relates to the pandemic. And maybe I'll direct this to someone who's joined us here for the Q&A session, Dr. Brian Mansfield, who many of you know is our interim chief scientific officer. And maybe, Brian, I can direct that first question about the impact of the pandemic on retinal research to you.
Yes, thank you, Jason, and welcome everyone. It's nice to be speaking with you today. I think that this is a question that we really don't know the answer to yet. Clearly, the pandemic is not yet over. We've been through a very chronic, hard phase for a while where there were a lot of closed downs across a lot of states. But of course, some states remained open. And the response to research labs for the COVID crisis varied from state to state, from institution to institution. And now, of course, we have seen rates drop for a little while, but now we're seeing resurgence of COVID in other states. And again, this is going to be leading to consequences in those states. So until the pandemic is over, we really don't know the full impact of what's going on. But let me share with you what we do know about what has been happening. In nearly all states, whether they close down or not, critical research, that is long-term research where you might have a cell organoid culture that takes 12 months to grow up to the stage where you can do an experiment on, was allowed to continue. There was a limited access for a limited number of people into labs to ensure that those critical long time length experiments were allowed to go on. Since the initial burst of COVID activity waned, a lot of the universities and academic institutions opened up slowly, and many were allowed to return to a third or a half of the number of people that they normally had in the lab. People were cycling in and out on different schedules during the day and during the weekend to try and bring their experiments back up and to keep them flowing. So there's not been a complete close down of all of that research. And moreover, a lot of people have been using that time, even though they may have not been able to go into the lab, to do other work which is very productive. For instance, they're writing up reports, publications, planning experiments, submitting grants for the next funding round. And indeed, NIH does intend to hold those other rounds, just as we have, for funding ongoing research. So I think just like the FFB, we wait, we monitor, we try to understand the impacts, and we will all try to respond to them as best we can. The NIH has made it very clear that it's well aware of these impacts. It also is monitoring them, and it intends to be able to assist people to the best of its budgetary ability as we fully understand the need and the impact. So I hope that helps give you a sense of what is going on at the moment in this current environment.
Very good. Thank you so much, Brian. I think that was a great question and very topical and probably on a lot of folks' minds right now with the pandemic and its impact on our mission and our field. So thank you very much for that, Brian. We've got a number of questions for Halden. And Halden, I'm going to try to combine a couple of the thoughts in these questions into one. But perhaps you can speak to the clinical trial that you referenced in your presentation. It's happening right now in Australia. I know you mentioned that there are 4 patients currently enrolled, and you mentioned that it's happening in a subset of RP patients that have Usher syndrome. And one of the questions is if you can discuss the subtype of Usher syndrome that are looking to be enrolled in this trial. And then secondarily, maybe you could speak a little bit more directly to the goal of the trial, be it testing safety, efficacy endpoints, and things of that nature. So it's combining a couple questions into one, if you don't mind taking that, Halden.
I'm happy to. It is a double-blinded 48 participant trial, and it required a first round of a Vanguard group, which we've completed, and then we go to full enrollment. And there seems to be a great deal of enthusiasm, so we expect good progress in our enrollment into the early part of next year. Being not an MD or a scientist, I would have to tell you that my understanding is that the RP associated with Usher, well, we picked Usher because it has a potential for a fast track as an ultra orphan. The manifestations of RP are exactly the same as in any strain of RP. And so what we learn should be applicable across all forms and subsets of RP. So borrowing a little bit from Brian, I would mention that it's fortuitous that we decided to implement this trial in Australia, where we had run our initial safety study. Because Australia has had far less impact from COVID than we've had here in this country. And other than some minor delays, knock on wood, we don't anticipate any slowdowns in the trial due to COVID.
Excellent. Thank you, Alden. One follow-up question that has come up from a few folks is when the trial is beginning enrollment and eventually perhaps here in the United States, how would an individual find out or be considered for enrollment in the clinical trials?
Well, once we have a cleared IND to proceed with a full phase 2 RP trial in the U.S., I'm sure that FFB will be more than helpful in spreading that news, as we will. And obviously, anybody in my retinal tracker or any other association with RP, with FFB, is going to know about it and be alerted to possible participation.
Excellent. And then finally, Halden, do you mind clarifying that it is all Usher syndrome patients, not really a particular subset of Usher syndrome, as long as they meet the RP criteria? Is that correct?
That is correct, yes.
Excellent. Okay. Thank you very much. We've got a number of questions that I'm going to, again, combine into one. Really, they're related to the patient experience with RP. We've got an individual who's chatted in that their experience is variable from day to day. It looks like a fog. Sometimes other days it's clear. Another patient saying that their progression is very different in one eye as compared to another. And obviously every patient may experience the clinical signs of RP different, but Brian, maybe I could ask you to speak to some of the more traditional patient journeys related to clinical signs and symptoms of RP to try to answer some of those questions.
Yes, thank you, Jason. Actually, the patient-reported outcomes and patient experiences are an area of great interest at the moment in the inherited retinal diseases, because obviously, if you start to develop a therapeutic, you need to know what people would like to have resolved in the disease. Often the experience involves more than just a concern about the visual acuity, as some of these questions are indicating. And to get to understand that, industry now does start holding what they call patient focus and patient journey groups, where either before developing a therapy or in the early stages of developing a therapy, they seek people who are in the group of patients that they would like to develop the therapy for and hold discussions with them about exactly these questions, trying to understand what is the experience of patients with these conditions and what would they like changed about those conditions. At the registry, My Retina Tracker, receives almost weekly requests now from various industry partners to help find groups that can range from anywhere from 2 to 20 people to take part in industry-run focus groups and patient journey groups. So this is something that's a strong interest in. In addition, the foundation realizes that this is very important, and understanding whether these symptoms and concerns are resolved through the course of a therapy is also important to capture. And mostly these are not characteristics that are caught by the normal clinical measurements, for instance, of your peripheral vision or your visual acuity. And to that extent, the foundation is partnering to develop what we call PRO, or patient-reported outcomes. And under the guidance of Dr. Todd Durham, who's our Vice President of Clinical and Outcomes Research, we are developing essentially surveys which try to collect exactly this sort of information, document it and analyze it scientifically to give a usable endpoint to therapies as they are developed and tested.
Thank you very much, Brian. We've got a number of questions that have been chatted in. I know we have an individual that's raised their hand, so maybe we can go to Martha Steele. Chris, if you're able to do that. Martha Steele, I think the line is open for you to ask your question. Hi, Martha.
Yep. Can you hear me?
Yes.
Okay. Thank you very much. My question on the NQT intervention has to do with stage of disease. So it sounds to me like this particular intervention is probably targeted more to individuals who have some threshold of remaining vision, remaining viable cone cells versus those who have late stage disease with few remaining photoreceptor cells to work with. And therefore, I would assume that participants in the trial at this point are probably individuals with earlier stage disease and later stage disease. I just wonder if you would comment on that.
You want me to take that, Jason?
Yes, please, Holden. Yes.
Hi, Martha. Yes, since the death of the rods occurs first and peripheral and night vision starts to fade, for the trial, ideally, we're looking for people that still have good cones and central vision, and see if we can slow the progression of that blinding effect. So you are correct. Once the cones are gone, there's nothing we can do to retrieve them. We're just trying to lower the oxidative stress to a degree that the cones survive longer.
Thank you very much.
Very good. Thank you, Martha. Ben, I'm going to direct a question to you about the RD fund. there were several important updates you mentioned in the script or in the call earlier today on the RD fund. A couple questions have come in. If there's any additional information that you can clarify regarding the dairy announcement this morning from a science perspective, in terms of the target and I guess the cell type in particular, but also just generally now that we've had some success with the RD fund, what you envision going forward in terms of the strategy and some of the things we can expect with the RD fund going forward.
Yeah, happy to. So I think first question on the Videri technology, we're not at liberty to really disclose any more scientific information from the company, but the base technology that was licensed by the company was published by John Flannery in 2 fairly recent publications. So, if you have trouble, anyone has trouble finding those, we can get them to you as well. But they should be pretty easy to find. That goes into the science in a very great detail. Regarding RD fund strategy in general, I think we're already fairly late in our first fund. We've made 10 investments. So, what we're trying to do is basically cover a lot of different modalities. So we want to cover as much of the IRD space as possible in terms of gene agnostic technologies, a few gene specifics here and there, but really to cover early, mid, and late stage disease with a variety of different approaches. So it's a bit of a challenge to do that, but I think we're fairly well balanced. I'd say that one of the missing things that we're looking seriously at is regenerative medicine. We haven't found an investment in that space that meets our criteria yet, but we're actively looking.
Excellent. Thank you, Ben. Brian, I'm going to address a question to you again. A lot of questions, and this does come up usually in these calls, about genetic testing. And so maybe you could, number one, just remind folks about how they could get involved in our genetic testing program and my Retina tracker. But number two, there's a number of folks that have stated that they had genetic testing done, and either there was not a conclusive result that was found in the genetic testing, or it's been some time since they've been genetically tested and they're curious if they should get tested again. And then finally, if it was recently that they're genetically tested, but there was not a conclusive result, what should they do? So what is sort of like the most important thing for someone with RP to do if there's not a clear genetic result, I guess? So I'll pose those questions you to speak to.
Yes, thank you, Jason. So let me start out with explaining the current situation for getting a genetic test. The foundation has a genetic testing program which is associated with its My Retina tracker registry. But to be clear upfront, you do not need to be a member of the registry to order the test. We'd love you to join, but you don't have to be a member. What you need to do is approach the clinician who is looking after you for your eye care and ask them if they are able to order the genetic test from a company called Blueprint Genetics. Now, it can only be ordered by a clinician, so unfortunately, I and others in the foundation are not able to order it for you. You are not able to order it for yourself. You need to ask your clinician to do it. And if the clinician is not aware of the program or doesn't know how to get in touch with Blueprint Genetics, you can ask them to either contact us at the foundation or, more easily, go to the foundation's webpage and type in My Retina Tracker genetic testing. And it will take you to a page where there will be information about the testing program. There will be a PDF document that you can download for yourself describing what genetic testing is and what it will tell you and what it won't tell you. And there will also be a document there that you can download for your clinician, or the clinician can download for himself. And it tells the clinician how to go about ordering the test. Now, the test is one of the most, in fact, I believe it is the most comprehensive genetic test for inherited retinal diseases available commercially. The doctor, again, needs to order it for you. No one else can do it. It has to come from a clinician. The test itself, when the sample is received, and the sample can be either saliva or blood, it's your clinician's choice which one, takes somewhere between 4 to 6 weeks to get the result. And the result will be given to a genetic counselor. Now, that test is totally free. The foundation has a program through its partnerships which will allow us to cover the cost of that test. The genetic counseling is also provided free of charge by the foundation. And the genetic counseling is something that's really important to follow up on because it explains to you what the test tells you. And these tests are really complicated to read. They're not like a blood test where you have a high, low, normal, or anything like that. They are very difficult to read. Essentially, they're hieroglyphics of genes and mutations and variants and VUSs and all sorts of things that most of us never even talk about. But a genetic counselor is able to put that into easy to understand lay terms and not only explain what it means to you and your family, but also to tell you a little bit about any clinical trials you may be interested in looking into further, and also telling you a little bit about some of the preclinical research that is going on. So it's a really informative session. And during that counseling, if you're not a member of the registry, the counselor may ask you if you'd like to join. We'd love to encourage you to do so. It helps the field tremendously. And if you are, they will actually help you there and then online to create a profile in the registry. So the eligibility criteria for being tested really come to the other questions that Jason asked. At the moment, to get the test, you have to have a clinician diagnose you with an inherited retinal disease. And secondly, you need to affirm, or the clinician needs to affirm, that you have not had a genetic test that looked at more than 32 genes. Now, our test looks at 322, so tenfold more. But you mustn't have tested for more than 32 genes during or after 2016. Now, the reason is that the number of new genes that we've discovered since 2016 has dropped off dramatically. And those genes tend to explain only very rare cases of disease. So if you've had a good test before 2016, it's probably a good time to be tested again. If you've had a test since 2016 and not come up with a result, being tested on our panel is very unlikely to help you identify the genetic cause of your disease. And in that case, you're best to talk with your clinician about what you can do with your current disease. Are there any actions that you can take to slow the progression of the disease? They are really in the best position to advise you. I'm not a clinician. I really can't give you any medical guidance along those lines. But for those of you who find that you cannot discover your gene, you're not alone. About 50% of people who go through testing will not get a clear cause of disease from the test. And the foundation is well aware of this knowledge gap. And that is one of the reasons that we fund a multi-investigator program, which we call the Elusive Genes program, whereby we search for the genetic cause of the diseases which currently cannot be diagnosed by the current testing platforms. And they are discovering one gene at a time, slowly. These are hard genes to find, but they're coming. And as they come, they're added to our panels. And at some stage, we will change our guidance on when it's best to be tested again if you've already been tested.
Thank you so much, Brian. I do recognize that it's 2:00 here on the East Coast. We do have a couple other questions. I'm just gonna basically make one comment, maybe one last question, and then we'll wrap the call up. There's a number of questions about what to do now that you may have a diagnosis for an inherited retinal disease. And in particular, I mentioned in the earlier part of the call that we do have a national chapter webinar that is also going to feature some discussions around nutrition. And I wanted to reiterate that webinar is going to be on Saturday, November 21st, 2020. So just in a couple of weeks here, from 12 o'clock to 1:30 Eastern time. And the audience is really open to anyone, even though it's put on by two of our key chapters, but really anyone can participate. And that'd be a great place to get additional information about nutrition. The last question I'm going to actually ask you to answer, Ben, is about the regulatory environment. And there's a number of folks that have asked, now that a gene therapy has been approved, Luxturna from Spark, is that an accelerator for additional gene therapies being approved? Or how does the regulatory environment look at additional treatment options using the gene therapy modality now that you've got one gene therapy approved? And then maybe tacking on to that, does the accelerated approvals for things that are happening around COVID play into or impact the regulatory pathway for things in our space? So 2 regulatory questions I'll pose to you, and then we'll wrap up the call.
Yeah, I think that what the Luxturna program did for the field was really provide the roadmap. They essentially blazed a trail, and they really create a playbook for how to develop new therapies. Every program is going to be evaluated on its own merits for safety and efficacy, so they still have to go through the same process. But it's a little bit easier to make decisions about the approach based on some of the experience of the previous approval. So in a sense, it makes the field more wide open. That's why we have 40 plus clinical trials going on, because people really understand the roadmap, but it doesn't necessarily accelerate. It might a little bit in terms of decision making and maybe less mistakes made along the way, but every program still has to go through all the same steps. Regarding COVID, it doesn't necessarily help or hurt us as long as the agency is staffed well enough to be able to handle all these new applications coming their way. I think that's fine. It's not a national emergency, to evaluate the IRDs. They have their priorities based on the pandemic. But the pandemic's going to be under control here at some point, right? It's not going to last forever, and things will normalize. And I think as long as, like I said, the FDA is staffed to evaluate all these novel programs coming their way, we'll be fine.
Awesome. Thank you so much, Ben. And thank you to everyone for participating in today's call. It's a few minutes after 2 here on the East Coast, so we're going to wrap things up. I do want to remind everyone that for any questions that we weren't able to answer live today on the call, we will follow up with you via email. We do it every time. We've always got a long list of questions, and our team diligently goes through them and reaches out to every individual that asked a question personally. So we will reach out to you if we didn't get to your question on the call today. We really do appreciate everyone's engagement throughout the call and look forward to our next Insight Forum call in a few months. Thank you all very much and have a great rest of your day. Stay safe.